Hey, my name is Eugene Daniels, and I'm a reporter here at Politico. Typically throughout the year, my healthcare costs are very little, but thanks to this little injury right here, that changed a little bit. It got us thinking about the debate going on in the Democratic primary about Medicare for All lowering overall healthcare costs, weighed against raising taxes to pay for a single-payer healthcare system. Senator Bernie Sanders has been pretty clear that he would raise taxes on the middle class.
Yes, they will pay more in taxes, but less in health care for what they get.
But Senator Elizabeth Warren's plan has been a bit harder to pin down in the past.
Would you raise taxes on the middle class to pay for Medicare for all, offset obviously by the elimination of insurance premiums? Yes or no?
Costs will go up for billionaires and go up for corporations. For middle-class families, total costs will go down.
Warren is making sure she doesn't give Republican operatives an easy ad, with her saying something like she's raising taxes on the middle class. But all that criticism about her evasiveness pushed Warren to release a financing plan that relies on everything from higher taxes from the wealthy, military spending cuts, to comprehensive immigration reform. But the big headline?
We can have Medicare for all without raising taxes 1 cent on middle-class families.
That's been met with a little pushback from the OG on Medicare for All.
Not here to tell you it's going to be free, you're going to have to pay something, but it's going to be a heck of a lot less.
When you have any big change in policy, whether it's healthcare or taxes, people are affected differently, and some people will come out better than they would have been, and some people will come out worse.
Translated, there are going to be winners and losers in big policy changes, but the goal is to have the least amount of losers possible.
If you're paying a premium, and it's a high premium, and you don't have to pay a premium anymore, your taxes may go up less than your premium is going down.
Premiums play a huge role in the argument for and against a single-payer system. For those that didn't take Healthcare Costs 101 ever, the premium is the monthly amount you pay for your health insurance.
People with relatively low incomes will probably come out pretty far ahead because there are no premiums, because there's no cost sharing, and because they may not be part of the financing scheme. They may not have taxes. But for people who are higher income or even middle income, it's a little bit too soon to know for sure.
If you have employer-provided healthcare, you're likely splitting the cost of the premium with your organization. For example, my premium is $20.50 a month. Politico takes care of the rest, and that's basically all of my healthcare costs for the month. But with this little injury here, I had to pay $600 out of pocket just for it. Under Medicare for All, neither you nor the employer would pay premiums. That number would get shifted to the federal government, which is why taxes for somebody would have to go up.
So the thought is that if employers didn't have to pay health insurance premiums, they would then increase salaries. Your taxes might go up because you're in a higher tax bracket, or your taxes might go up because their tax is required to pay for Medicare for All, but your healthcare costs go down.
It's likely that groups of people will lose, even while most people would have considerable financial strain alleviated. But for others, those taxes may go up more than your premium would go down, or employers won't transfer their premium savings to their workers.
They're going to give back that money to the employee?
Matter of fact, they will.
Well, let me tell you something. For a socialist, you got a lot more confidence in corporate America than I do.